Hello class, this is Sarah. I'm glad to make this presentation to you. It's based on a study paper written by Dr. Virginia Sino, RN, and it's titled Being with Dying, Authenticity in End-of-Life Encounters. Within this paper, Dr. Sino notes many families and dying family members have unmet needs. Healthcare professionals are unprepared for caring for people as they die. They are unprepared or unable to show authenticity. I'm sure some of us can relate to this in some measure if we have been with family or loved ones during an end-of-life encounter, not knowing what to do or say and being uncomfortable. We'll learn through this study how being with dying requires authenticity in end-of-life encounters. This study examines how and why nurses succeed or fail at communicating well in end-of-life care. The reason for this is that most healthcare professionals are unprepared and unable to show authenticity while caring for people as they die. What does that mean? It means being emotionally appropriate, responsive, and responsible toward the dying patient. Within this study, Martin Heidegger, who was a philosopher from Germany during the early 20th century, used interpretive phenomenology analysis, which is a qualitative research method. This method provides the language, background, structures, and metaphors used to interpret narratives from the nurses that were interviewed and spent time with the dying. The purpose here is to use the patterns from interpretive phenomenological analysis that attest authenticity from the nurses in being with the dying. Nurses were interviewed for this study to discover how their experiences with end of life affected the patients, the family members, and themselves. The study revealed patterns about presence and authenticity and how these areas are vital in caring for a person at the end of life. From Heidegger's interpretive phenomenology, Dr. Sino developed a 5-point framework to interpret the findings. How did Dr. Sino gather the findings about authenticity in end-of-life encounters? 6 nurses were interviewed as the study participants, and these nurses were chosen because of their mean years of practice, which equaled 22 years, and their excellent reputation, ability, and skill to assist families and patients with a peaceful death experience. What constitutes end of life? Imminent dying, having only a few weeks or months to live, a prognosis of 1 year or less if the disease takes on a normal progression, or sudden death. To extrapolate the information from nurses during the interviews, they were asked about all the times they had cared for a dying person and families and how they helped these people better cope with death. I have to say, I didn't know what a phenomenologist does. I've never heard of the term before, so here's an explanation for those of you who may be in the same boat as I am. A phenomenologist focuses on qualitative research, insight and experiences, much more than on trends and data. Martin Heidegger's philosophy on which this study is framed is about the patterns for authentic being with dying among nurses who attend to the dying. What does it mean to authentically approach death? Heidegger's research reveals structures that show most end-of-life encounters are with people are inauthentic because they are not facing up to death due to denial, through anxiety, custom habits, emotions, attitudes, and cultural norm. According to Heidegger, inauthenticity in dying is an evasive flight from death, which can be shown by these characteristics: concealing reality, hedging or evasiveness, drawing to the ordinary, using soothing cliches, and separating. Heidegger believed that a person could move from inauthentic to authentic through the call of conscience and by being willing to hear the call. This call comes through an ontological guilt, which is felt at the gut level as a gap between who we are being and the way we ought to be. Ontology, I found this definition in Webster. Ontology is the philosophical study of the nature of being, becoming, existence or reality, as well as the basic categories of being and their relations. Heidegger helps us to understand how to understand and be ready for the dying experience in 2 stages. Authenticity toward death through what is deeper within. And number 2, because authenticity arises from deep within, it is possible to practice being each day. Once we accept the process of death, we become more aware, and it becomes part of the core of who we are, and then we can better relate to life and relationships. This is called attunement. At last, we go beyond a quick moment of empathy to a full, sustained presence, which allows authentic being. During the interviews of the 6 nurses, 240 pages of information were gathered, and this was enough material to begin to draw conclusions, because at a certain point it's saturated and the responses become repetitive, but they're still diverse. Dr. Sino used the computer analysis program NVivo of all the documentation and interviews, and 5 definite themes emerged. Dr. Sino then created a 5-point framework. As established in the 5 patterns of an authentic person, being with dying, the nurses in the study showed an authentic attitude toward death through Stage 1, the acceptance of death. Stage 2, personal experiences with dying and death, connecting through experience. And 3, they possess an authentic and calm state of mind, openness, they're non-judgmental and professional, yet personable. They listen and they are present. Stage 4, they have the ability to identify needs. And stage 5, the ability to address those needs for others through personal situation and self-regulation. Too often, healthcare providers unintentionally add suffering for vulnerable persons at the end of life. The study revealed it's critical to be comfortable in quality end-of-life encounters. Families and their dying loved ones are desperately trying to get their needs met. Through this, they are anxious, they feel helpless, they are depressed, and often they are filled with grief, tremendous grief. A lack of information from the healthcare community can lead to increased angst and contention. When communication with the healthcare staff has been established, it's been shown that patients and the families feel cared for and connected. They feel the support and they feel ability to make choices, to be informed and included. Yet these are the missing elements between healthcare staff and families. Consequently, changes are really needed to support families and patients in the end-of-life care. The good news is nurses from this study have all shown that they each understand being with dying and authenticity in end-of-life care. And most healthcare providers hold core values of being competent and caring, showing compassion to be helpful to others. The study asks, can being authentic in end-of-life encounters be learned? And it's determined that, yes, through self-development, it's possible to become proficient in the mind discipline of the authentic, that being authentic requires. The study also suggests that through prayer, meditation, silence, reading of scripture, retreating, chant, and forgiveness can assist healthcare professionals to become conduits of love, compassion, and freedom. Being still, being present, showing compassion and presence. We all have a natural capacity of our minds if we're willing to nurture it. Healthcare professionals who want to take this step of learning about authenticity and being should seek out others who have had good end-of-life encounters and be prepared to research and discover how being present looks. Dr. Zeno suggests that much more research could be done within the healthcare industry to include doctors and nurses, social workers and chaplains to ascertain a more complete picture of inauthentic and authentic being with dying. From the extended research, further education and training programs could reduce barriers to care, communication and connection at the end of life. The experience of a good death by patient and family should be a primary outcome of end-of-life care. As a result of this study, clinicians should be hopeful in this. Many have been able to accept death in their own lives, which is a huge part of being with dying and authentic end-of-life encounters. In addition, we humans are extraordinarily adaptable and able to demonstrate amazing coping skills, managing adversity in difficult and challenging situations. So in conclusion, progress to being authentic and being present is about hearing the call and working toward a deep and personal acceptance of death. I found this to be a fascinating research paper by Dr. Zeno. Having practiced as a nurse and being with many dying people in my life, I can attest to the awkwardness of nurses and doctors while interacting with the dying and families. Throughout my professional life, I remember each death very clearly to the point of being extraordinary. I believe there is a deep spiritual element involved in accepting death. I have experienced this with each death. It's almost transcendental. That, to me, is authentically being present at the end of life. I hope that we are ready to be present and authentic with the dying, because as gerontologists, we may be present at many end-of-life encounters. Throughout time, many religious and holy people have given advice about the acceptance of death. Gautama Buddha, Jesus, Gandhi, and Mother Teresa all speak to living and dying. The Dalai Lama leaves us with this advice. May we realize that there is no time to waste, death being definite, but the time of death indefinite. What is gathered will separate, what has been accumulated will be consumed with residue. At the end of a rising comes descent. The finality of birth is death. Thank you for watching and listening.